team SALT worked with Teladoc, and they worked on preventing or identifying or preventing malpractice in telemedicine. Team SALT.
Hi everyone, we're Team SALT, and with our project TelaHance, we're rethinking telemedicine. I'm Tanay.
I'm Surya.
I'm Lou.
I'm Alan.
And I'm Grant.
Direct-to-consumer telemedicine is a rapidly growing industry, and in the last year, Teladoc has facilitated over 15 million telehealth consultations, and we believe that there is a serious gap in the clinical quality of telehealth consultations today. According to a study conducted by Harvard, medical liability claims had an estimated annual cost of $55.6 billion to the United States healthcare system. Telemedicine providers need to resolve these claims quickly and efficiently. Additionally, with the rise of telehealth consultations, doctors don't have access to a medical scribe to record important medical information. In 2015, physicians without scribes had a nearly 10% lower productivity rate when compared to those who did. So how does the industry respond to these issues?
The current review process at many telehealth providers is a manual review performed by internal auditors. And according to Medscape, 53% of doctors believe that a medical panel that screens cases would discourage lawsuits. With the high volume of consults and many doctors who have had a malpractice claim against them, there needs to be a more scalable approach for Teladoc and other telehealth providers to review consultations, keep doctors accountable, and screen for wrongful claims. Additionally, in a telehealth environment, many doctors are forced to take on the role of both doctor and scribe, which adds additional work. As we saw in the previous slide, physicians are 10% less productive without scribes. An additional workload can decrease the doctor's ability to communicate and lead to misdiagnoses, which diminishes the overall clinical care quality.
Our application attempts to remedy these issues. First, we will use sentiment analysis on the consult to identify problematic conversations, such as patients exhibiting drug-seeking behavior. TelaHance enables clinics to provide more reliable services by assigning a numerical score to each consult. If it exceeds some base threshold, these transcripts will be highlighted for internal review by nurse analysts. These analysts can then view the appointments and examine the specific sentences during the consultation that were flagged. Furthermore, telemedicine is a relatively novel technology which allows physicians to provide care remotely. With TelaHance, we proactively seek to address rising concerns in telemedicine by identifying problematic telehealth appointments, providing an automated medical scribe for doctors, and detecting probable patient conditions using our intelligent diagnostic assistant, IDA. Our medical scribe provides doctors with a transcript of the consultation, as well as a list of symptoms identified during the consultation. IDA makes use of these symptoms in order to develop a list of conditions that can be used by the physician to supplement their diagnosis.
Meet Dr. Tanay Komarlu, a doctor who works for TelaHance, and Lou Han, a patient of Dr. Komarlu who has been feeling sick the past few days. Let's look at a live demo to see how TelaHance facilitates and assists this interaction. From the homepage, Dr. Komarlu can go to the appointment dashboard to view his upcoming appointments. And here we can see the appointment that Lou just scheduled along with the purpose. Let's have a look at the consult view. Before Dr. Komarlu calls Lou, he can open our intelligent diagnostic assistant IDA to analyze any symptoms, risk factors, or conditions that the patient mentioned in their reason for visiting. And as we can see, TelaHance analyzes the purpose of the appointment to provide tangible insight prior to the consultation. Now Dr. Komarlu can give Lou a call. Keep in mind that there may be an audio delay over Zoom.
Hello, is this Dr. Komarlu?
Yes, good afternoon. I understand that you haven't been feeling well. Looks like you have a fever. Are there any other symptoms you've had recently?
Well, I also have been feeling really nauseous and even vomited.
Okay, have you started coughing?
Yes, and sometimes it's with green mucus, and sometimes I have a sharp pain in my chest.
I see. Have you been diagnosed with asthma?
No, I have never had asthma.
All right, so based on that, I think you have a stomach flu, but we should just schedule another appointment for next week to make sure that your condition doesn't get worse.
What the hell? No, I need my damn drugs now. What use are you if you're not going to give me my drugs?
I'm sorry, I can't do that.
Hey, what am I paying you for? I can't deal with this crap anymore. Goodbye.
Now that the consultation has ended, let's review it. And as we saw, TelaHance transcribes conversations and identifies symptoms in real time. Additionally, we were able to display probable conditions and follow-up questions. By doing so, TelaHance provides physicians with actual insight during the conversation. And while our tools are very accurate, natural language processing is a very difficult task. In the case of an inaccuracy, we provided the doctors and analysts with the flexibility to make changes to the transcript and symptoms as they see fit. And while Dr. Komarlu finishes his review, let's see how an analyst like Grant might use TelaHance to examine consultations.
To improve future doctor-patient interactions, I want to determine if there have been any problematic consults recently. I'm interested in assessing consults with profanity, so let's filter for only those. It looks like Dr. Komarlu recently experienced a problematic consult, so let's see what went wrong. We can scroll down through the transcript to find the parts of the conversation that had issues. As we can see, this section from the patient seemed to be problematic, so let's listen in to make sure that the transcription was accurate.
What the hell? No, I need my damn drugs now. What use are you if you're not going to give me my drugs?
It seems like TelaHance was correct to flag this section, so let's ensure that the doctor also responded appropriately.
I'm sorry, I can't do that.
After examining the doctor's response, it seems like the doctor was not at fault for these issues. Since doctors have the flexibility to make edits to the transcript, we ought to check that Dr. Komarlu didn't make any edits that could mislead us. We can switch between the original transcription and the doctor's edits, which preserves the integrity of the dialogue and TelaHance's sentiment analysis. To conclude our review, let's visit the admin dashboard to understand how Dr. Komarlu compares to other doctors on our platform. Here, we can select profanity and display the likelihood that Dr. Komarlu uses profane language at any point in the consultation. Since Dr. Komarlu doesn't differ much from the average, we can feel confident that he is providing great care to his patients. We also have the power to view how TelaHance doctors are performing collectively. We can select categories such as profanity, toxicity, or insults, which can help indicate if our efforts are improving the experience of telemedicine.
Now that you've seen how TelaHance helps both doctors and nurse analysts, let's talk about our design philosophy.
Our primary design goal is to create an experience that reduces the needs for the doctor to multitask, and instead focus on providing the best care for the patients. And while our services are very accurate, they are not perfect. So we integrated seamless tools for doctors and auditors to use to correct these issues and to make sure that the medical suggestions are accountable. The corrections can then be used to improve the models in our service over time. And most of all, we want to assist doctors instead of replacing them. The doctors could only see the suggested questions or conditions when they want to, so that TelaHance suggestions won't affect their decisions involuntarily or unconsciously.
Now let's learn a little bit more about how TelaHance actually works. Our application makes use of a serverless architecture to scale and handle the large volumes of data that telemedicine platforms process on a daily basis. We decided to make use of a Node.js microservice to process these calls in real time. Now let's take a closer look at our Node.js microservice.
This service consumes a real-time media stream via Twilio's voice API and streams audio to Google Speech-to-Text, a service that supports HIPAA compliance, in order to transcribe the consultation in real time. Our consult data is processed by Informatica's API to leverage their powerful named entity recognition services and enables TelaHance to identify patient symptoms during the consultation. Informatica makes use of the surrounding words to identify if a patient mentions a symptom and can process those symptoms to provide a doctor with the most likely conditions for that patient. In order to identify problematic consults, we also utilize Perspective API, which uses machine learning to identify toxic or problematic comments that might arise during the call. When a TelaHance consultation ends, we send the transcript to Perspective API to quantify the sentiment of each speaker. We then store these results in our database so that when nurse analysts review consults, we can label and flag problematic doctor-patient interactions.
All of these services working in tandem allow us to build a product that revolutionizes telemedicine. With TelaHance, we are able to assist in the diagnostic process through IDA, bolster doctor and patient relationship, and fundamentally improve patient care. After the call, we ensure that telehealth providers can measure and track the quality of their healthcare services. Telemedicine is the future of medicine, and we believe TelaHance is the next step. We'd love to give special thanks to our teledoc mentors, John, Social, and Javier. Without their guidance, this would not have been possible.
Thanks for listening. We'd like to open the floor to questions.
I was impressed with the user interface that you put together. I wanted to see if you received feedback from prospective doctors or patients in evolving that and making it the way that it ended up.
We had a bit of insight from some meetings with our mentors and some people in the industry that helped to give insight into things like minimizing user interactions, making sure that the doctor doesn't have to click everywhere on the site and multiple times, and so minimizing that became like a primary design focus, and we sort of built around those principles for our application.
Thank you.
My question has to do with permissions. Does the patient have rights in terms of you're recording my phone call with my doctor?
Right. So we decided from the beginning that this would be an opt-in service, that patients would have the flexibility to choose whether or not they wanted to be recorded. There's a lot of concerns with data privacy, especially in the modern era, and we wanted to make sure that that was an option.
I have a question. So did you have, with the accuracy of the predictions, did you have any problem with that, or any comments on that with the AI technologies?
Are you specifically referring to the predictions of our speech-to-text model or the accuracy of our named entity recognition?
So you have multiple.
Yeah.
Any of those, I know, which ones, did you have any trouble with any of those?
I think speech-to-text probably had the most trouble.
Yeah, so speech-to-text is a relatively novel technology, and it's constantly improving because there's different accents to take into account. So what we did to try to counteract that is implement a custom vocabulary that recognizes patient names, unfamiliar medical terms if we can. And our goal is to look into other models that provide a better fine-tuning of the user experience. As for Informatica, they perform their own benchmarks, and we can utilize their API and provide a filter that compensates for misspelled words. So.
Okay, thank you, Team Salt. And I want to say, in general, with these Capstone presentations projects, when you see these things become reality in 5-10 years, you can say that, well, I remember I saw this in Capstone as a Capstone project, and it did happen many times in the past. So I think it will happen also for these projects this year.